Did you know that there are some medical emergencies of the spine? My name is Dr. Betsy Grunch, and I am a board-certified neurosurgeon who specializes in spine care. We often think in neurosurgery that we deal with emergencies all the time, but they're usually dealing with the brain. But how often do medical emergencies actually affect the spine? Yesterday, I presented the case of a 32-year-old woman who presented to the emergency department with acute back pain radiating down both legs. She says the pain began a few days ago when she tweaked her lower back. She's been taking over-the-counter medications and has been icing her back, but she leaned over to get something out of her seat today and noticed excruciating pain radiating into both legs. But she also noticed some numbness in her perineal region. What's the perineal region? She was a little embarrassed to say, but she was numb down yonder ways, in her private parts. They wanted to obtain a urine specimen in the ER, and she tried to go to the bathroom and couldn't. A little bit later, she noticed some urine that was dripping down her leg, and when she went to wipe herself, she couldn't feel it at all. This is extremely concerning. Luckily, the emergency room doctor was just as concerned as she was and sent her for a stat MRI of her lumbar spine that's shown right here. What you are seeing here is a large piece of disc material that's herniated out of its normal spot and is stuck compressing the cauda equina. What most people don't know is that the spinal cord actually ends around L1. Then the spinal cord transitions into a bunch of different nerves that's called the cauda equina. Why do they call it that? Cauda equina is Latin for the horse's tail, and as you can see, it kind of looks like a long horse's mane. I mean, I don't know, you be the judge of that. Nevertheless, those nerves are extremely important as they go to supply multiple different regions in our legs, as well as the perineal region that supply our bowel and bladder function, as well as a sensation in the genitalia. There is a disease process called Cauda Equina syndrome that is a surgical emergency. It's where the nerves of the cauda equina get acutely compressed by a disc herniation, a blood clot, a fracture, a tumor infection, or other things that may compress those nerves and lead to a set of symptoms that can indicate the patient is in distress. Without immediate treatment to relieve the pressure, the patient can have permanent nerve damage. That can mean permanent inability to go to the bathroom, meaning urination and defecation, and the patient may have to permanently in and out catheterize and digital stem for the rest of their life. It can also lead to permanent loss of sexual function, as well as chronic pain and even paralysis. And even with immediate treatment, there are some patients that don't fully recover, but what we do know is that the sooner the treatment is initiated, the better results they'll have for full recovery. Here is another MRI example of a patient with Cauda Equina syndrome, and what you see is this square right here is the vertebrae, here is the L5 vertebrae, and this is the L4-5 disc. This white space right here is where all the nerves typically travel, and you can see that this patient has a extremely large disc herniation at L4-5 that's completely obliterating the spinal canal and causing severe compression of those nerves. That, in my opinion, is the most common presentation of Cauda Equina syndrome. The most common demographic that this disease process affects are women between the ages of 30 to 39. When I'm on call, I see this happen at least once a month, and I cannot remember the time when a patient did not meet that age demographic. It's almost always young women. I'm going to speak a little bit off the data here. That age demographic typically are the ones that get gaslit by the healthcare profession. They come into the emergency department in a lot of pain with some weird symptoms, and they can be chalked up to being hysterical. That's why it's important for every single one of you watching this video to know that those symptoms are not normal. Back pain that's acute and pain that radiates down the legs is extremely common, and we see this all the time. But what makes this particular diagnosis critical is the saddle paresthesias, or the numbness in the perineal region, as well as the inability to go to the bathroom. That means the nerves that go to the bladder are completely compressed and is not telling the brain that they have to go to the bathroom. And that includes the nerves to the bowels too. So if the patient goes hours with these nerves being compressed, they can experience urinary incontinence, or basically where the bladder becomes so distended that urine will just leak out and the patient cannot feel it. The majority of cases are caused by a massive disc herniation in the lumbar spine. The disc is a material that sits between the bones in our spine, and it's completely encased by a material that's called the annulus, which is like a hard coating. And you can develop a weak spot from injury, like whenever the patient stated she started to have a tweak in her back. That weak spot can lead to a herniation where material can leak out of the disc and compress the nerves. When she said she leaned over in the seat and felt that acute pain, that's when she extruded a massive piece of disc herniation, compressing the nerve roots, causing the Cauda Equina syndrome. The data suggests that prompt surgical decompression of the nerve roots within 24 hours of symptom onset is paramount in the recovery. In other words, time is spine. Now you might be thinking 24 hours, that's a long time, but you got to think the patient has to recognize that their symptoms are serious. They have to go to the emergency department and find a provider that listens to their symptoms and orders the appropriate imaging study in a prompt amount of time, and then subsequently calls a surgeon that recognizes that this is a surgical emergency and can get them to the operating room as soon as possible. In our patient's case, she presented promptly to the emergency department when her symptoms onset. Her diagnosis was recognized by a provider and the MRI was done, and we had her in the operating room within 5 hours of symptom onset. I performed a procedure called a lumbar microdiscectomy, where we remove a small amount of bone to get to where the disc was extruded and remove the fragment of disc that was compressing the Cauda Equina. She stayed in the hospital overnight so we could make sure that her bladder function was normal and that she was safe to go home. So after she woke up from surgery, she was able to feel her perineal region. She went to the bathroom and we performed what's called a post-void residual to make sure that she was fully evacuating her bladder before she could be safely discharged. And if she couldn't, she would need to be catheterized. She was discharged home on postoperative day number 1 and went on to have a complete recovery. Cauda Equina syndrome happens in 1 to 3% of all lumbar disc herniations, and unfortunately, not everybody achieves a full functional recovery like in our patient. Studies show that up to 40% of patients can have residual neurological deficits, and up to 10% can have permanent bladder dysfunction 5 years out from their injury. So remember, back pain is extremely common, but back pain that's accompanied by numbness in the perineal region is not normal and can represent a surgical emergency. Another case of patient-focused and compassionate care. Stay tuned next week and I'll go through another case.